Thank you. We have millions gun on our head. So he says only this means only 4 minutes. So please, any 4 questions, each only for half a minute for question and half a minute for answer.
Raju, you mentioned about digoxin. What is the present status of digoxin in the heart failure with reduced ejection fraction? Because there's one big trial coming up with the digoxin in this era now. That is one thing. Is there any role of digoxin which you can
One
accept?
question only, one question per person. Limit, he is looking at me.
Uh, Basically, heart failure with reduced ejection fraction, if he has atrial fibrillation, then I think ESC 2022 had very good paper from UK saying that yes, digoxin must be used, but only thing the DISH level should be a little below 0.9 nano. Normally we say 1.2 to 2. Instead of that, 0.9 nano should be useful. So that is especially if there is AFib. But otherwise,
No, without AF, you don't indicate it actually. Without AF,
Else? You can ask because there are no other questions.
So second thing, Raju, you mentioned about the GLP-1 has a very big data on the preserved ejection fraction coming up. Because any drug which can reduce the obesity can really work well. Apart from SGLT, there will be great useful drugs. GLP-1 will be there in the future actually. And
yeah,
of course,
basically, I think tirzepatide and of course GLP-1, this other GLP-1. So they are also following the footstep of this thing.
But basically, weight reduction is very
SGLT2.
important there.
But there still we don't have the evidence as yet. But I believe that because not only obesity, it's not the obesity, it's the inflammatory biomarkers which are inflammation which is inside, which along with our obesity which goes down, which is going to be useful. But only the time will give answer to your question.
Dr.
Yeah.
Miran, one question. The value of cardiac rehab in this improving ejection fraction?
So again, no data to back that up, sir. Generally, my patients who've had an improved EF, they've already completed their rehab training. What our rehab program does is they just prescribe a home exercise program and they keep touch points maybe once in 3 months or once in 6 months with them. So no real data, but this is what we do in our practice.
Thank you very much. Actually, let me give you one inside information. Milind, Satyavan Sharma and S.B. Gupta, three of them met for 5 hours to decide how to save every minute. Thank you very much.
Thank you for a wonderful session. I am sorry to be a party pooper and stop it every time, but whatever time is exceeded here will be lost in the tea break. So make up your minds. So we have a tea break now, 4:19 p.m. Please come back, 4:20 we start. Thank you.